Hey everyone, it's Dr. Singh here from Erin Vision Care here in beautiful St. Albert, Alberta. Considering it's age-related macular degeneration awareness month, I know it's a mouthful, or what we in the biz like to call AMD, we just want to make a short informative video talking about risk factors, treatment options, and how to kind of get on top of it sooner rather than later. So what is AMD? It is when there's damage to the retina, which is actually inside of your eye. So it's a little model here, that's the front of your eye, obviously. And then when you go inside this orange looking part here, that's your retina. And that's actually the processing center, which allows us to see and gives us our vision. More specifically, there's an area on this retina that's called the macula. And that's the area where that gets damaged when you do have or diagnosed with AMD. And the macula is responsible for giving us our central straight ahead vision. And like I said, that's the area that's damaged when you have AMD. So let's talk about some risk factors. So of course, age is a risk factor. It's age-related macular degeneration. So usually generally over 55 years of age. Ethnicity, so Caucasian, European descent, more susceptible to this condition. Blue eyes as well, less pigment in your eyes. Family history, positive family history like mom, dad, aunt or uncle. Cigarette smoking's a risk factor. Obesity as well, so which is linked with high cholesterol, high blood pressure, and also high energy visible light, and also UV radiation. Let's now talk about the types of AMD. So there's two types, there's dry form and wet form. Dry form, you may not have symptoms at all yourself, which is very concerning and places an importance on getting your eyes checked regularly. Or tested regularly. So in the dry form, there's these tiny yellow deposits, protein deposits called drusen, and that can form in the retinal layers and start disrupting the retinal layers. And that can cause, less defined vision, cause colors to be more dull, less vibrant, and also, the need for bright light to kind of see a little bit sharper. The way to slow this down and kind of slow the progression is to take vitamins, a vitamin supplement, similar to this one here. This is what we use here. And this protects from sunlight damage. Having a healthy diet, green leafy vegetables is important. Stopping cigarettes is also an important factor. And also just exercising regularly will kind of help. And last but not least, obviously sun protection. So wearing sunglasses with UV protection is very important. Now in some cases, this dry form can lead to wet form macular degeneration. Now this is when there's abnormal blood vessels that begin to form. And since they are new vessels forming, they tend to be a little leaky. So they can leak blood into the retinal layers and really disrupt the layers and severely blur out your central vision. That can cause scotomas or blind spots. This particular type can lead to total central vision loss. It's important to get on top of this condition a little bit earlier, as I mentioned before. This is generally the type of AMD where we get the ophthalmologist involved and begin the discussion of unfortunately getting maybe injections or some sort of laser treatment depending on the case, because every case is a little bit different. Diagnosing AMD is as simple as getting to your nearest eye care professional and get some imaging done, just get your eyes tested, and getting on this degenerative condition a little bit sooner rather than later. Most optometrist offices will have the ability to take some photos, some fundus photos, OCT imaging, visual field assessments. They'll probably give you something like an Macular grid right over here as, just a monitor at home. That's why we at Erin Vision Care rely heavy on getting your eyes checked annually and regularly. If you have any questions or concerns, please call us at Erin Vision Care. The number should pop up, or leave us a comment down below, and stay tuned for our next video.